Good morning or good afternoon to everyone, depending on where you are joining us from. Welcome to today's panel discussion on the parentification of newcomer children and youth. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples for their valuable past and present contributions to this land. My name is Mariah Maddock. I use the pronouns she and her, and I am the project coordinator on the N4 team. I will be hosting and moderating today's panel discussion. Andrew Tomeyer is our co-host for today, and Andrew will be monitoring the question, answer, and chat box today. Today's panel discussion brings together varied perspectives on the parentification of newcomer children, and these panelists work in diverse settings, including private practice, acute care, and the education system. And I'm very pleased to introduce to you our panelists today. And our first panelist is Dr. Tanya Lentz. And Dr. Lentz is a registered psychologist with a background in clinical psychology and clinical neuropsychology. She was formerly head of the Pediatric Neuropsychology Service and was one of the psychologists responsible for the Rehabilitation Psychology Service at the Janeway Children's Health and Rehabilitation Center in St. John's, Newfoundland. In her private practice, she provides psychological and neuropsychological assessments and treatment for children, adolescents, and adults. Throughout her career and education, Dr. Lentz has studied and worked in multiple provinces across Canada. She is a passionate advocate for improving medical care services across the country. She is a member of the Diversity and Inclusion Committee and Respect and Civility Committee for Eastern Health. Tanya also sits on N4's National Advisory Committee. Through these committees, Dr. Lentz strives to create bridges of understanding and communication between staff and patients, particularly those who are new to Canada. Welcome, Dr. Lentz. And our next panelist is Rama Musharbash-Kovacsi. Rama is the Windsor-Essex Catholic District School Board Community Ambassador. She works with all newcomer families and their schools and helps guide them through the educational system in Ontario, bridging barriers, connecting newcomers to the community, and coordinating outreach opportunities within the school's community. She is also the co-founder of the LaSalle Hangout for Youth, which is a Canadian registered charity supporting at-risk youth in LaSalle. Rama has her bachelor degrees in exercise science and education and also has her master's in human kinetics. She is an immigrant herself and knows firsthand what it is like to live that experience. Rama is always looking for ways to better the experience of newcomers and help them become a contributing member in their new communities. Welcome, Rama. And our next panelist is Cindy Dawson. And Cindy is a certified child and youth counselor who has worked at CHIO Mental Health for 18 years. She is currently the clinical manager of onecallonclick.ca, a regional coordinated access and navigation program. Cindy has worked in various capacities, such as the team leader of centralized mental health intake and system navigator for Project ECHO, Ontario Child and Youth Mental Health. She has extensive mental health experience in working with community partners, families, and high-risk youth. Cindy is a strong advocate for self-care, balancing family, and her passion for running. Welcome, Cindy. Today's session is being recorded and will be uploaded to our N4 platform when it becomes available. We will share this with you as soon as it becomes available. And if today, for whatever reason, there's any technical difficulties, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take just a moment into the platform features, which we hope will enhance your participation experience. Throughout today's session, we invite you to write your questions in the question and answer window. And we know sometimes you might have the same questions, so you do have the option today of upvoting questions that you're interested in hearing the answers to. And we do anticipate that there will be several questions today, so we will prioritize the questions we ask first based on the ones that are upvoted and at the top of the question and answer box. And our panelists today have no conflicts of interest to declare. With that said, I'll jump right into today's panel discussion. So I'll just invite the panelists to turn on their cameras. And today I'm going to open up with 2 introductory questions. And then for all of those who are in the audience, we will rely on your questions to guide the remainder of the discussion. And then we'll wrap up with one final question. So I'll start with our first question, which is parentification refers to children and youth taking on adult roles and responsibilities that are not normative for this age in order to support their parents. When families migrate to a new country, navigating the health and social service systems can be very complex. As a result, newcomer children and youth often experience taking on tasks that are not typical for their age. So our first question to the panelists is to tell us, what does the parentification of newcomer children look like? How do family systems and role dynamics in newcomers' families shift after families arrive in Canada, and why does this happen? And let's start with Dr. Lentz.
Thank you, Marie. So really, when we're looking at parentification, there's a number of different factors that we need to think about. There's different types of parentification that have been looked at in the research literature and then in clinical settings. We're looking at instrumental or more functional parentification. So this is taking on roles such as cooking, cleaning, taking care of younger siblings, and so on. And then there's also emotional parentification. So that's taking care of a parent's emotional or social needs. In healthcare, one of the main areas that I find parentification occurs is actually because children tend to be used as what we call language brokers. So they're responsible for interpreting and translating medical information to family members. This really occurs because children may have been exposed to the dominant language where they've immigrated, so English or French here in Canada, and they may have been exposed prior to coming to Canada in school, or when they come, they're immersed in that language. So they're directly provided instructional resources as well as in socialized Asians. They tend to get a lot of that English immersion that parents don't necessarily have. In medical settings, due to these skills, they tend to be put in a position of interpreting and translating medical information. So they're having to try to express medical concerns accurately and then provide medical information back to the family members for medical decision making. So some of the things that we need to consider in that is that it requires a very high level of linguistic skills in order to actually be able to do that. And as well, they may be exposed to information that they wouldn't normally be exposed to. So certainly in some cultures, topics such as an abortion or a miscarriage may not actually be discussed with younger family members. But in the position of language broker, they would have access to that information. Youth can be expected to provide serious diagnoses such as cancer to their family members. And so they're having to cope with their own emotions, their family members' emotions, as well as trying to convey information accurately. Another area of concern in this is some of the microaggressions and other forms of racism that may occur in those interactions with healthcare providers. And so then the youth is then responsible for having to manage those aspects. So you can imagine this is a huge level of responsibility for a young person to be experiencing, as well as trying to manage their own responses to whatever occurs in that situation. As well, it can really change some of the family dynamics. The individual who is playing language broker then now has a very powerful role in the family. So they're the gatekeeper of information in that setting, and they may actually provide information to the healthcare provider in terms of making those decisions that may or may not be what the actual patient requires or desires. So really here, the onus is on the healthcare workers to actually use appropriate interpretation and translation services that do not involve the family member. And that's how we can protect children and youth from getting placed into that role where they may really feel uncomfortable, and it may also make your patient feel uncomfortable in that role.
Great. Thanks so much, Dr. Lentz, for starting us off. That was really informative. And Rama, what are your thoughts on this question? You're just on mute, Rama.
Thank you so much for having me today. Parentification of newcomer youth in schools is totally different because the amount of exposure for the student in school is the whole day. So we see them in a longer term. So we see a lot of things that we notice, just like stereotypically North American gender roles within their families. These youth also continue to expect their own family's expectations. So not only just how to become a Canadian, how to immerse in the culture, but also keep at the same time the expectations from their families and cultures as well. This could be sometimes somewhat stressful for these kids because newcomer youth in schools learn Canadian ways and behaviors, and they seek to fit in with their Canadian peers. But also at the same time, they always have to remember to balance those expectations with those with their families. For some youth, also the pressure and expectation in school are demanding. So adding those experiences to those within their own families means that the youth are unfairly burdened at some point. Moreover, they are often the most confident English language speaker at home. So for that, they're always asked to leave school and attend family appointments, visitations, any paperwork that needs to be done. Parents tend to just pull out their kids from school. So that also, like the amount of absenteeism at school affects their English acquisition learning, especially in the early months of school. When they come in, they're still trying to learn the language. The amount of times that they get pulled out of school is a lot, just because they're the most language speaking person at home. So that affects them as well. But regardless of being dependent upon, even during the school day, like many appointments, meetings, and community services all happen during the day and during schools. So they have to accompany their family members to act like translators, scribes, negotiators, tour guides. And furthermore, based on their birth order, they have to always attend for their younger siblings. We notice that a lot with newcomer families, where elder siblings have a lot of responsibility to take care of younger siblings. And that also affects their schooling. And also for female newcomer students, we see that a lot when the parents pull out the kids either at the end of the day early or in the morning they come late because they're being at home expected to do chores, taking care of younger siblings when family is busy, when parents are not available, cooking meals, and just taking care of the whole household. So that amount of pressure too on newcomers, females, we notice that it affects their education as well. And it's just a burden on them because they want to fit in, they want to get along with other kids, they want to get introduced to what school is. And we have to remember that for many of them, they haven't been in school for years. So because of war-torn countries, girls being in refugee camps and stuff. So they come really excited, and this mixed emotions with them that they're wanted at home and there's expectations to what is expected from them at school. It just creates a lot of burden and stress on these kids and their families as well. Furthermore, we noticed that with some newcomer female students who turn 18, they start exploring the idea of marriage as soon as they hit 18, because they're most likely to drop out of school to get married because they see it as a way to support their families by bringing an extra income to the household. So once they hit 18, the tradition in some cultures where they get married and an extra income comes to the house. So in their minds, they're helping out their families, supporting their families, and giving back to their parents. So sadly, we see some of them dropping out just because that's the culture, that's how they are raised, that's what they know. Also, during the pandemic, we have seen many newcomer youth that had to grow up fast to find employment in order to be able to support their families. Once classes went virtual, that was even easier for them to start just listening to their classes on their smartphones and find jobs at the same time, which definitely not ideal. Also, our location in Windsor, Southwestern Ontario, there's a lot of agriculture sector here. So a lot of students started finding jobs 45 minutes away from the core city. So they have to ride the bus every day, 45 minutes one way to go work on farms and factories, and that definitely affected a lot of our students' language acquisition, learning, and their schooling as well. But they had to support their families. That's the expectations that was put on them by their families as well. And because children learn the language faster, they start getting exposed to rules and regulations in Canada, and they have to guide their parents through it all. So they feel responsible, they feel they need to support the family, the siblings, and so that all affects them. Also, like, we have to remember that newcomer families and adults, they don't immerse in the community as soon as they come because of the language barrier, because they're adults and they're so much more anxious about their language acquisition and them not knowing how to speak English. So they tend to live in communities where there is a lot of majority of newcomers as well. And that it is good for them mentally, but that also affects their language acquisition and them learning how to run their errands in Canada and what needs to be done on a day-to-day basis. But because the students are immersed in the community by going to school, they get the education, and then they feel the burden of doing all the paperwork on behalf of their parents and having to be aware of what the rules and regulations are and how to apply for services and extra support at home as well. This shift gives the children a sense of responsibility, and in many occasions, the feeling of burden, as I said, that they have to assist their parents and grow up fast. Some newcomer parents also tend to put a lot of pressure on their children to excel in school. So last thing I want to talk about their school performance. A lot of newcomers tend to make their kids feel like they're responsible of taking care of the family in the near future, and that adds a lot of pressure. And the three top most asked things to do is to become a physician, a lawyer, or an engineering at all times, and that just creates a lot of pressure on the kids, and especially the youth that are 16, 17 coming in, because they haven't been in school in many cases for many years. They still have to work on the language acquisition. So for them, that pressure that is put on them, that they have to support the family really soon and ask of these in particular sectors to work in, also creates a lot of pressure, and that affects the kids, and they start thinking about school as a burden on them, and it's a stressful place for them. So just communicating with the families, always reminding them that we take it step by step. We have all the time for their kids to learn the language and then build on their skills and go towards what they want to do. We always remind every student and their families that it's attainable. You can be whatever you want here in Canada, but you have to work for it. And in order to work for it better, you have to just build one stone upon another. So yeah, that just the main reasons why Canadian newcomers have to grow up fast and support their families at an early age.
Thanks so much, Rama, for articulating some of those impacts and drawing on your experiences in a school setting and your lived experience. And Cindy, you're in an acute care setting as a clinical manager. What are your thoughts on this question?
Thanks. I think the biggest thing for people to remember when we're asking for services, when you're looking for services for newcomers, is to make sure that you're actually looking and ensuring that you understand the needs. Oftentimes people look at one's history and assume that there's certain things that a family or a youth need, but it's really making sure that we're meeting the family and youth where they're at to access services. So a couple big pieces in that is being able for the youth to be able to express what they want or what they need to work on themselves. We want to look at their different social determinants of health, make sure that we're actually, they have food at home, make sure we're looking at the holistic picture of this young person and what makes their family work. I often see where we have older siblings being the advocate for younger kids. And really, that's not respecting the youth's privacy either. Their health information is all going through a sibling where it really should be kept confidential. So it's really important that they have access to translation services, or even better, services in their mother tongue. Trying to provide therapy through interpretation services also can be really challenging, but sometimes it's the reality of what we have to work with. So trying to look ideally for culturally appropriate services that offer services in their mother tongue. If it's not possible, making sure we do interpretation services, despite the push that we get from parents or aunt or friend or whatever, to be able to actually do that translation for them. The young person still has the same right to privacy as every other child does. And I find when we're working with people who don't speak French or English are common languages, then they end up getting their health information shared to people that wouldn't normally have access to that. So, and it becomes easier for healthcare workers to reach families through an aunt or through someone else because they speak English and we can give them an appointment, but really making sure that that's actually appropriate and that people are always putting on the lens of that HIPAA requirement of us respecting privacy. That's a big piece that we see in our hospital, that we have interpretation services readily available, and we make sure that we use those as opposed to using youth and families. And then goal setting, it's really important that we're actually know what are we working towards. If this young person is struggling with their mental health or addiction services, we want to know what is it that's contributing to it? What is it that they need? Some people can assume that, you know, someone has experienced a trauma, that they need trauma therapy, but is that youth ready for that? And making sure that we're meeting them where they're at to achieve their goals to be well in this community. Their goal might be to be able to be invited to a birthday party. So your goal might be to start looking at learning social skills or understanding how to read social cues. And culturally, that's a big piece for them. So I think acknowledging those gaps and being able to support them with the pieces that they want to work for allows them to be their own self, the same way we would any other youth that came into Canada or born into Canada speaking English or French. They should have the exact same rights. And that's where it's really, really important for us as healthcare providers to make sure that we are really looking at each situation in a really open way. So I think that, to me, that's the biggest piece where I see this having an impact. And I think it's a really good thing it's an easy win for us to be able to be aware of that and offer services and ask the right questions so that we are getting them on the right path of where they need to go for services.
Great. Thank you so much for sharing that, Cindy. And I'm going to move into our next question, which is around the impact, the parentification of newcomer children, youth, the impacts that it has on them. So can you please describe the impact these shifting role dynamics can have on children, youth, and their families? And I believe all three of you just mentioned about what those shifting role dynamics can look like. And what are the emotional and psychological impacts in children on youth when they are expected to take on tasks that are not normative for their age? And what are the signs that should prompt professional intervention or support? So we'll start with Dr. Lentz.
So when we're looking at parentification, one of the things I do want to point out is that not all parentification has actually been found to have a negative impact. So we really need to be cautious about applying our own cultural biases on that. Certainly, there's a very strong Western and predominantly Caucasian bias that childhood should be a very carefree time without a lot of responsibility. Whereas in a lot of other cultures, childhood is actually seen as a time where you develop skills for adulthood. So we need to just be mindful when we are looking at any parentification that we're not actually applying that bias to it. When we're looking at things that tend to be more positive in terms of taking on some adult responsibilities, is we find that children do much better if the responsibilities are shorter term, if they're acknowledged by the family and appreciated by the family, and part of teaching children just having give and take in relationships. So for example, if a child has to take over tasks because, say, a parent has broken their leg and they can't do the cleaning, that's actually considered to be quite a positive for children. And again, it's time limited. It's not intruding on a lot of other activities for a long period of time. When we see more negative effects of parentification, that's when we're looking at where it's prolonged. And certainly, as like Rama had talked about really nicely, is that this idea where all of the other activities, so like school, social activities, things like that, are kind of put to the side in order to be able to complete those activities, such as attending appointments and so on. And it's not necessarily recognized and appreciated by the family members that they've had to give up these other activities in order to do so. It's just an expected form. So when we're looking at kind of more positive effects, certainly we would see that kids are gaining in some of their independent skills, some of their navigation skills, and so on. But when we're starting to see things such as we might see children kind of withdrawing from social groups or spending less time with social groups, we might see impairment in terms of their academic completion or less participation in academic activities. We might see some increases in terms of substance use. We might see more anxiety, depression, and even self-harm in kind of more extreme cases. So it's certainly something where we want to be mindful of if we're starting to see personality changes in the child, and then start to talk to the families about some of the concerns that we might have, and help them in terms of providing supports such as appropriate translation services, but then also connecting them to organizations that might help with a parent's mental health, a parent's social interaction with the community, so that that's not a responsibility put on the youth.
Thank you so much, Dr. Lentz, for exploring those positive and negative impacts. And Rama.
Yeah. First, I want to tell Dr. Lentz, like, I definitely agree with you. It is a cultural thing. We view childhood as something different, and we have to be careful how we say that this is right or wrong when coming with newcomer families. I just want to say a little bit about the positives of being that kid that is helping the parents. Is they become more responsible faster. They get challenged to learn the language faster because they want to impress and support their families better. They're all seeking for employment at part-time employment after school, which that is amazing for a kid that is 17 telling you, Miss, help me find a job. And kudos to them for doing that. At some point, every teenager in Canada get jobs at 16, 17 to be able to afford the things that they want. So part of the parentification, like maybe it's not parentification, but part of taking that responsibility is helping some of the newcomer. But at the same time, it's hurting others. So the unrealistic expectations, though, and responsibilities are surely a burden on some newcomer youth, and they seeking to participate in school life and extra activities and stuff like that. So learning to get along with other students and navigating the education system, and also learning how to help their families and support their families and get out of school for that long also is a challenge for them because they can't balance both together. So home and family responsibilities always take presence with these kids. Students reveal that they feel overwhelmed and torn between performing their school duties and being that person at home that want to support their families as well. School staff, mostly they report noticing that absenteeism, poor performance, incomplete tasks, exhaustion, and distraction in newcomer youth. It is also not uncommon for newcomer youth to be summoned during the school to be a parent. By parents phoning them, texting them on their smartphone directly. So for the kids, you will always see newcomer youth saying, Miss, my mom is on the phone, I'm leaving the classroom. So that happens as well. And as a school, we can't stop that because that's disrespecting the parents in case of an emergency. So it's just an act of balance that we do at the school system where we try to educate the families, but at the same time, give them that support that they want from their kids and keep their family relations on the side. Also, schools must take every effort to communicate with newcomer families to outline school policies and rules to protect youth without disrespecting their cultural norms and expectations. It's also common to see newcomer youth dealing with identity crisis a lot at school, where they want to be immersed in the Canadian culture. They want to participate in extracurricular activities, sports, social events, and all these outings with their friends at school, with their Canadian friends. However, parents have other responsibilities and expectations for them. and they don't understand the difference. So they get really a feeling of resentment towards their families, that I want to do this, but my parents won't let me. They don't understand the bigger picture. So that affects the youth, and it affects their self-confidence too at school, because they're the ones that can't go, they're the ones that can't participate. And also the sense of belonging, that the feeling that you feel that you belong in a school family, in a school team after school, that all plays a big role in being comfortable at school and having fun at school and enjoying the experience, which will allow you to enjoy the learning as well. And want to make it makes the newcomer youth wanting to study more and wanting to excel more when they're more involved in the school. And that's something that they don't get in some cases. And also at times, newcomer students start asking for more independence from their parents. And when they start to have that confidence to ask for more independence, we find out that the family relationships unfortunately deteriorate from that part, and parents start resenting school. And they start hating that the kids are going to school and putting it as a back burner just because they're afraid of their kids participating and spending a lot of time at school, after school especially. And then it makes the kids also, again, just hate the fact that their parents are saying no. And it just breaks the relationship between the family and the student. And we definitely don't want that. So our schools, I know that we work hard in trying to involve newcomer parents. And we get them to take part in sessions to introduce the importance of after school activities and taking part in school activities. And we just show the families and teach them every day the importance of being part of the school family, how extracurricular activities are safe. There's teachers available after school. And this concept that newcomer families seem to understand is like, after school, then there's no teachers, then I'm worried about my kid. So it's just all educating the parents about the Canadian school culture, the education, and how it's run, and that every activity after school is led by a teacher, right? So that's all important things that we have to break the ice, build bridges between the family and the school in order to, it's a team effort, and it's not a overnight thing that can happen for a lot of newcomers. And we just have to work it out. And I encourage every service provider to always just build that bridge between themselves and the youth, or the school as well, the school or the institution that services these people. And we find out that, like, once you build that bridge, and once the newcomer parents understand that this is not compromising the safety of their children or their identity, that's when they open up and they start being more flexible and allowing their kids. And in many cases, we see newcomer parents after a year, they're enjoying it and participating in these things too. So that's really rewarding to come and watch the kids playing sports, music. So we see progress, we see it coming along. So yeah, that's what we see at schools.
Great, thanks, Rama. Thanks for sharing also some of the ways that you built those bridges between parents and the schools. That's great. And Cindy.
Thanks. Yeah, I think this is really well covered about the different aspects of things we should be looking for when we're, wondering whether or not a youth or child needs to actually start accessing services. I think a couple pieces that kind of stick out for me is around the stigma. Parents, Rama touched on it quite a bit about the cultural norms and being aware of that, but the stigma that might be related to certain cultures and various cultures, even if it's outside of newcomers, relating to mental health and possible addiction services that might need to be accessed. So it's important for, and I know I spoke a lot about the privacy piece, but that's why it's really important, is that the stigma might be that when they're not okay, how do I ask for help and where do I go? There are some opportunities if youth are feeling a little bit ambivalent about accessing services, then they can do some research online to be able to get mental health resources, so they can have information sheets. They might know that they don't feel quite right themselves and they want to be happier, or they have different goals that they want to work on, but they don't know how to ask for help. So CAMH actually has a list of, it's called Asking for Help When Things Aren't Right. It's basically a fact sheet in how to help people ask for help when they need it and when they feel like they needed the support. It's offered in various different languages. So having that importance of being able to print that off, maybe hand it to them. And I always say, they might not be ready to access services right now, but if you provide them the paperwork and you leave it in a position where They could pick it up if they wanted to or not if they didn't, but it allows that opportunity for them to maybe read it and maybe get a bit more understanding. So it's really important for us to be able to offer them information in their own language, where they can actually find out more information on their own, where they don't actually have to reach out if there's a bit of a barrier or there's some ambivalence. And then that hopefully will kind of be enough information to make them say, maybe I do need a little bit of help and maybe I am more willing, or maybe they say this is enough information for me and I'm going to take up journaling and this is going to go really well. So whatever works for them, it's just making sure that we provide them the tools to know how to advocate for themselves.
Great, thanks for sharing those insights, Cindy. And we'll try to link that tip sheet as well when we share the on-demand version of the webinar. And I'm going to move right into our audience Q&A. I can see there's lots of questions here in the question and answer box. And I encourage anyone, if you have questions, put them in the box, as well as upvote questions you're interested in hearing the answer to. And so our first question is open to all the panelists. And it is, when parents request that their children interpret for them, and interpreters are in short supply for their language, how can service providers make sure that the children aren't being parentified or relied on for translation and interpretation?
Certainly in my experience in healthcare, most healthcare workers have a phone, right? And so there are accessible interpreters, and it's amazing how many different languages that we now have access to for interpretation services. Most healthcare organizations now have a particular provider of interpretation services. And so it is really something that's important that you connect with, your managers at your healthcare organization to find out what provider you have. If you don't have one, potentially insist that you get one, because that is certainly something that's really important, because then you're kind of taking that out of the family's purview, where then you can have appropriate services and you don't have to get any family member in that position.
Great, thanks, Dr. Lentz. And our second question is, what about conflicts between teens and their parents during this transition? As some of them may not be happy with the shifting role dynamics that were discussed earlier. Have you had any observations around this? And if so, what do you do to address this?
Yeah, we see that a lot at school with a couple of newcomer families, where the kids, as I said previously, where they start asking for more independence. They start asking to spend more time at school, do their thing, not what their parents are asking them to do. And without educating the parents, it is rough. It gets a little bit, there's a resentment towards each other. And we see that the kids are not understanding why the parents are expecting them to do all this. But at the same time, the parents are not understanding and open to the kids to do stuff other than what they're supposed to be doing or expected to be doing by their parents. And in most cases, this looks like a lot of miscommunication. Once we sit with the parents and we introduce them in their own language, the importance of what their kids are doing and why we encourage doing it. And then at the same time, we encourage the kids to always have respect their parents and talk to them and be patient with them. We always remind the students, especially that are in high school, that, you know what, it's a transition for everyone. They're stressed out, you're stressed out, at least, let's figure it out together. You have to be patient as much as they're patient. We compromise. We try to compromise, teach both parents and youth to compromise a little bit at a time. And then things usually get better really quick as soon as both parties are educated of what needs to be done for them to have their happy medium in between. But also reminding the families that there are a lot of settlement agencies in the area that can support you instead of you pulling your kid is huge, because these families are really concerned about who's going to help me and who's going to assist me. And the fact that educating them, we always educate these families about what agencies are there and how to access them and how to support them. Because once parents realize that there is these services, they stop asking the kids, because they don't want the kids to be involved in it anyway. So just a lot of education, a lot of patience, and compromising on both sides at the beginning, and gets better after.
Yeah, thanks so much, Rama. It sounds like those partnerships are really key as well. And I could see Dr. Lentz and Cindy nodding in agreement as you were speaking. And I'll move on to our next question, which is open to all of the panelists. Is there a difference between the different cultures around responsibilities of the parentification and children of youth? So does the parentification of newcomer children and youth look different across cultures?
Certainly, that's been my experience. There are many cultures where caregiving, and certainly Ram had mentioned this earlier, gender roles within the cultures as well are different. And so it is something to be mindful of even working with families and really exploring that with them, of what their expectations are within their culture, and not making assumptions based on either our own biases or on our understanding of other people's cultures, because there's also many subcultures within a major culture. So it is certainly something to explore with the family, and that may not be at all relevant for that particular family. So it's definitely something that I recommend exploring with them versus assuming.
And I think Dr. Lentz has a really good point, because even within, we look at newcomer culture, but we look at, Canadian culture, and each family has their own makeup and their own, you look at birth order and you look at all these other things, and you might see families that are large families where you see it happening there as well. So it's that really looking at, not assuming where it's happening and where it's not, and asking the questions to be able to identify, is it a problem or is it not, right? Is it something that needs action, or is it something that that doesn't? And that's regardless of who you're working with, whether they're newcomers or not. So it's important to appreciate that.
Great, thanks, Dr. Lentz and Cindy. And our next question is open to all of the panelists, and it almost builds on that question. So is this happening to all newcomer children and youth, the parentification? And if we consider the categories of immigrants, in which group of immigrants do you mostly see these challenges? In which parts of the world or countries are the majority of your clients from?
I guess from my perspective in healthcare, I mean, we have people from all over, and certainly because I've worked all over Canada, I've had exposure to all different kind of newcomers. I find, again, it's really dependent on the family. Not all children are treated the same way in families. So certainly the eldest tends to be the one who ends up with more responsibility. As a overall group, probably females in particular tend to have more of those responsibilities. But again, really going to be dependent on the particular family, the family circumstances, and what their needs are when they come.
Great, thank you, Dr. Lentz. And we have a question and a comment next. So the one participant, what we've spoken about, and panelists, what you've shared really resonates with them. And they are now a settlement counselor, and they work with clients, they work with children and youth. So their question is, in my work with clients, I encounter many children and youth who take on the parentification roles. How can I better support these children in my interactions with both them and their parents?
I guess it really depends on what the concerns are, because that's going to be different for every client that you have. And certainly, like Rama had pointed out, really creating some of those community relationships, really even that education about what they can expect, what some of the challenges might be, so that they're aware ahead of time. And that whole idea that ourselves as healthcare workers, settlement workers, education workers, and so on, really have that understanding that it is a process. They're not going to come in and do this process perfectly. And to be honest, there are no perfect parents and there are no perfect kids. So it is something certainly that we also have to recognize, that it's going to be a process, and that there are going to be moments where we might need to provide more support. And just to be aware that some of those community connections in particular, like Rama said, we can get that load off of the children and youth and have parents connected to appropriate services, such as like mental health services for themselves, and so on, so that then that isn't placed on top of the children and youth.
Yeah, I agree with Dr. Lentz. It's a lot of patience, and it's not going to happen fast. And that's why I said, like, it's building relationship with these. And once they trust that you are looking for their kids and for themselves and their benefits, this is huge for newcomer families, because they come here, they don't know anyone, they're afraid, they're worried about their culture, their kids maintaining the culture, the language, the religious beliefs. Like, there's a lot of stake on the family and the parents to keep their kids into what they know, and just reminding them that it is a multicultural environment in Canada. It is we love diversity. We love you keeping what you have and sharing it with us, and we share with you our culture. It's important for these families, and part of it is fear. And once you break that fear with just building trust and building more education and knowledge to these families, it gets better really quick after that.
Thanks for adding to that, Rama. And our next question, it's a question and a comment. So thank you for all this information. And this participant also resonates with what's being discussed. And so they're now working as a student and family advocate in Ottawa, and they're looking forward to using this information to reduce harm and stress on their students. And their question is to all the panelists, do you see this issue amongst newcomer youth and second generation youth equally, or are there significant differences?
We tend to see it in second generation, but a little bit different, where the parents are working and they speak the language, but still the expectations of you supporting and helping out your siblings, helping out at home, the chores that you have to do. And again, the fear of the culture being lost within their kids is even larger with second generation, because they feel like now the kids are born here, so they don't know what their culture is firsthand. So the fear is a little bit more. You can see that tendency to have fear of your kids participating in other activities and stuff, because they want to spend the time to teach them about their own culture and resonate them within their own culture. But we see it in both, and it's a little bit different, and the responsibilities are different as well. I noticed that schools with second generation.
Great, thank you, Rama. And Dr. Lentz, looks like you're going to add to that.
I completely agree with what Rama was saying. It's really different in terms of what the focuses of concerns can be, simply because second generation parents may be working, they may already have some community ties and so on, but I do see a lot of that fear around loss of culture and loss of kind of that child's participation in the home.
Okay, thank you. And so our next question is open to all the panelists. So while acknowledging the North American and Western bias for kids to have, quote unquote, in quotations, childlike childhoods, is there any neuroscience backing for the positives and negatives of parentification? So I might look to you, Dr. Lentz, for this one.
So certainly having children learn the ability to kind of manage in moments where things may not be going well. Certainly there is a lot of research around that, as well as being able to learn skills such as even how to make a meal and so on. Certainly there is a lot of research in terms of supporting some of those aspects. So more of that functional parentification that I was talking about earlier. We tend to see better outcomes with those children. So we tend to see that organizational skill, ability to attend, plan, and problem solve. Those types of skills tend to develop better. But certainly if we have children who are engaging in more of that emotional parentification that I talked about, where they're taking care of emotional and social needs of parents. We can actually see where children have decreased problem solving, attention, and so on. So, and more kind of consistent with, depending on how extreme it goes, more consistent with kind of the trauma literature on some of the changes in neurobiology.
Great, thank you for that information, Dr. Lentz. And next question is actually a comment, and I'll let you panelists read that. But someone thanking you very much for all this information, lots of important aspects to be mindful of. And I'll move down another question, which is open to all the panelists. The participant is saying, I appreciate that teachers are available after hours to assist parents. However, does the possibility exist to obtain parent education regarding the Canadian school culture in the form of a slide deck or training video that we as service providers could present to our families? And they go on to say, many of our families have children with complexities, so finding the time to meet with the teachers is not always possible. So panelists, are you aware if anything exists, and would that be appropriate?
Yeah, I've seen a lot of videos on settlement.org, the website. There is a whole section for videos about elementary school and how does elementary school works, and what to expect at parent-teacher interviews. And there's a lot of videos as well on that website, and it's translated in a lot of languages. So I encourage you to go to settlement.org and check that out. Also, like the school boards, sometimes we notice that they put some videos as well, tutorial videos for families, and sometimes it's translated as well. I know like our school board, Windsor Essex Catholic District School Board, they invested a lot in newcomers, and they're trying to help out and build the bridges between. And my role is to do these events and communications, and we do it at least once a month, an educational event where we have webinars or Google Meets and stuff for families and sessions. So I encourage them to just check at school board websites if there is anything, but settlement.org has a lot of information.
Great, thank you so much, Rama, for sharing those resources. We'll try our best to at N4 to link everyone to those resources when we share the on-demand version of the webinar. And we are coming to the end of our panel discussion. Any questions, though, that are in the question and answer box, we'll move on to N4's Meeting Place, our online moderated discussion forum. And our panelists today have agreed to answer your questions there in the forum. So if you have a question, we will put it there. And I encourage you to sign up to become a member of N4 to see those responses. But I did want to ask one final question to you panelists today. And that is, if there's one piece of advice you could leave with the audience today around what we've discussed, what would that be and why? And let's start with Dr. Lentz.
I would say probably my biggest advice is take the time to talk to the family to see what we can be providing that's better in support. And it also helps us really check our own biases. If we're actually checking with the family and checking what some of our concerns are with them to make sure that they are doing what we think they might be doing in that situation. So really kind of taking that step back and saying, okay, wait, what is the actual situation before making assumptions?
Thank you so much. And Rama.
Yeah, as school staff members, like listening to newcomer youth, letting them tell you their story, their stresses, what worries them is really important, because that's when they're going to feel comfortable and they're going to feel secure and that someone is caring for them and looking out for them. And that's when trust is built. Also, a lot of education to the parents and not to tell them how to live their lives. It's an open-minded, like Dr. Lentz said, be open-minded, look at it from the back, like look at the bigger picture, examine each one on their own, see what their feelings are. And then you understand more, because as I said before, in some cases it's good for the kids and they're being responsible and encouraging them to be good. But at some point it is a lot on the kids. So I always encourage just talking a lot, opening up with these kids, let them open up to you, document a lot, because sometimes after a couple of weeks, you're like, oh, but he said that. Oh, now it makes sense, you know? So like, I just encourage you to like talk a lot with them, open line of communications, keep them open between the family and the youth themselves, and just document and always revisit. Oh, like, don't overthink it, but always remember what happens. It's just, it all falls in its place at the end.
Great, thanks so much, Rama. And Cindy.
I think my biggest thing, and I think it's really about speaking to the same kind of the point that both Dr. Lentz and Rama have spoken about is really meeting youth and families where they're at, really understanding what is it they want to work on, and then supporting them with those services without your own bias of what you feel they should be working on. So meet people where they are at and get the information that you need to be able to support them with the things that they want to work on. It's I think that really helps with the trust, it helps with the engagement, and it lets them know that you're on their side and you're willing to walk the walk with them. If it sometimes that might mean throwing a basketball around in the yard to build the trust, and sometimes it might actually involve sitting and having one-on-one therapy. But whatever that looks like to build that relationship, that's the important part for you connecting with these youth.
Great. Well, thank you all for such wonderful advice, lots of food for thought. And today it's been a really rich and informative discussion that we've had. So I just want to thank you, Dr. Lentz, Rama, Cindy. Thank you so much for taking time to be part of our panel discussion today. And I also want to thank everyone in the audience who asked questions today and engaged or tuned in to listen. Thank you for your time, and you are welcome to join us again for an upcoming N4 events that we have upcoming. And if you missed any part of the panel discussion today or would like to watch the session again, we will be posting the recording on the N4 platform with a transcript. And as I mentioned earlier, any unanswered questions will be moved over to N4's online moderated discussion forum called The Meeting Place. And Andrew is going to put the link to the N4 website if you're interested in signing up, or if you haven't already, in the chat box. And we also will try to link some of the resources that were mentioned in our panel discussion today when we share the on-demand version. So with that said, I'll just wrap up the webinar now and let you know also that there will be a survey that will pop up in your browser when you close the webinar. Your feedback really does help us to improve. So please complete the survey if you have time. And I'll just turn it actually back to our panelists. Do you have any final words for the audience today before we wrap up?
I just want to say that I really appreciate that so many people are really motivated to, come in, see the seminar, and really help our newcomer families.
Great.
I just want to thank everyone for all the support and for wanting to listen about this. It's something that we deal with on a daily basis, and I think that for us as service providers for newcomers, we have to always be alerted and just look for signs that the kids are not feeling comfortable and the parents, and just keep educating them.
And I just want to thank you for having me for this. It's really fun to be part of a panel discussion and see how many people are so vested in working with young people and their families. So thank you for having me.
Okay, thank you all, and to everyone who's joined, we hope you stay safe, and hopefully we'll see you at a future N4 event.